on the project on the Canary Barn and what I think most of you know about. I grew up in a small farming town in Ohio, which is smaller than Saratoga, actually, 1,200 people or so. And then I went to Michigan to undergraduate school and medical school, and came out to Colorado and to study transplant type surgery, which was very in its infancy at the time. And I was drafted. In fact, all of us as interns were drafted that year because of a buildup of Vietnam that was going on. And I was drafted in the Army, and they sent me to aviation medicals training, and from there I went to Germany, and in a short time I was sent to the country of Laos, which I knew nothing about then, and ended up for a short time in Vietnam. Hopefully it works. And Laos at the time I found out was they were at war. There was continual bombing going on. It's mentioned that 2 million tons of bombs, more than all of World War II. 500,000 civilians or so were killed, and I witnessed a lot of those and a lot of the injuries that came out of that. It's a country that was left with the most unexploded ordnances on Earth. I don't know if that still holds up with what's going on now, but they remained there a few years ago. And the war was a secret war. This country denied it, our government denied it, everybody denied it, and those of us that were there signed non-disclosure agreements. And there was about 40 of us that were there as non-CIA. We worked with them. The CIA was running that war. This came out in the newspaper in 2010. He received the Medal of Honor for his service in Laos, and the last paragraph in that says that his late wife had known about her husband's actions but was sworn to secrecy, and she kept the promise to her husband and her country all those years. And that's not even telling her own sons. And that was how I think those of us that went there treated it. We honored the secrecy of it and the non-disclosure agreements. And I know I didn't tell many people around me. Now, as the years have gone by, some of it's become public. We had some helicopter accidents and other types that involved U.S. Notice there's no U.S. insignia on those helicopters. There was no U.S. insignia in the entire country because it was a secret war, even though they were ours and we were using them. And because of some of these injuries, we were transferred to Vietnam, a hospital there, and I was there for a couple of months almost, and I witnessed some trauma to our own soldiers, which was really the first time I did that. And that was traumatic, and still is if I think a lot about it. But I went back came back to the States and kind of switched my majors for various reasons and ended up in neurosurgery training. And once I did that, I went to Boulder, Colorado, and was there for some 32 years. And during that time, I continued to do various things that I'd gotten very interested in. And one of them was indigenous peoples, and I was invited to go to see if this works any place. I was invited to go to a place in Indonesia. Yeah, there it is. which was on New Guinea Island. New Guinea Island is the second largest island on the planet, and the eastern half is Papua New Guinea, western half is a province of Indonesia, at that time called the Irian Jaya, now it's called West Papua. But it's very remote. The people that live there are very traditional mostly, that are not Indonesians, and I had the chance of getting to know them and visit them. And in this case, I took a daughter with me. I tried to take someone with me when I went. She was 15 at the time, but this is a group of people that had been headhunters and cannibalistic in the not too distant past. And so we spent time there. The people there live in an intense tribal area. There's over 300 distinct languages that have been discovered throughout this area of the world. And new tribes are discovered there, and there's a few of them left, I'm told. These were examples of a couple, or one tribe, and these were the people that were living there. I found them to be I found a lot of illnesses, and this was pneumonia. And a week later, on a little penicillin, it looks a lot different, doesn't it? And that penicillin was a miracle drug, and is still. I'm not going to talk to you about that or this type of medicine, but it's also very interesting. I am going to talk to you about traumatic brain injuries. And that's a special area that is developed in medicine, and especially my area of medicine as a neurosurgeon. It's, as you'll see, it's become the most common injury on our planet. And that back then, when I was in school, we didn't know as much about it, and a lot of the people ended up with complaints of dizziness and wooziness and headaches and pains here and there, and acting, and we couldn't find anything wrong with them. Exam is normal, no tests, X-ray, MRI, CAT scan would show anything, and so we thought they were probably having emotional problems, and we tried to get psychiatry or psychology interested in working with them. But it was that type of a thing for many years, and maybe still is in some parts. While we've made improvements, as you'll see down the line, we still don't have good imagery to define what some of it is. If you remember, any of you remember the show of Patton, or seen the show of Patton? Well, there was this place in there where General Patton got very upset for a kid in the hospital and kicked him out of the hospital and what have you, because he was there for a mental illness due to shock, it said. And, well, General Eisenhower kicked Patton out of that job. And there's a whole long story about that I can't have the time to tell you about now. But at any rate, I became very involved in head injuries. I think I saw most all the head injuries in Boulder, Colorado, in Boulder County, for all the years I was there. And I was the only neurosurgeon there for some of them. But, and then in the military, we were very. In 2000, right after 9/11, I ended up becoming head of neurosurgery at this hospital, which is in Landstuhl, Germany, and a major hospital for our military. And I was the only neurosurgeon between Okinawa and the United States for a year and a half or so. And we started to have the fighting was going on in Afghanistan at the time, and then into Iraq. And this is an explosion. It looks big on the picture, but it's an IED, which is an improvised explosive device. People, I'm told, made them in their garages and out in the field. They're very inexpensive to make, and yet this is what basically beat us out in the whole war, and still is a major problem because we can't get rid of them. And they cause lots of injuries, severe injuries. And I'm not going to show you all the gory pictures of that, but we defined them into blast injuries, and the signature injury is a traumatic brain injury. And that, 35% of the injuries in the military are traumatic brain injury. It's often delayed, and therefore may increase with time, may be disabling for a lifetime. And it's now pounded more because we didn't have this type of explosions up close in previous wars. We give our soldiers, I'm going to lean on, you see that? Yeah. We give our soldiers palm testing devices to check their own neurocognitive test as to whether they're getting worse or not, because they're all given cognitive tests before they go out in the field. And it's considered to be now the brain leading cause of death and disability around the world. And about 3 million a year in the US, 70,000 deaths, 215 hospitalizations, and a significant cost, and a lot of permanent disability. So traumatic brain injury is divided into these 4 categories: severe and moderate and mild. And this is based upon what's called this thing here, and it's a trauma score, really. And people that are severe, have severe injuries, are often comatose or severely affected for some periods of time, frequently die. Moderates are less so, but they have something that you can see is wrong with them. Mild traumatic brain injury, you can't find anything wrong with them. And this is the same designation as a concussion. And I don't want to get crossed. A concussion is a mild traumatic brain injury. And mild traumatic brain injury is a concussion. And then we have penetrating, and because a lot of people ask me about that knife in the head case, I thought I'd just summarize it. This was a lady I cared for down at Denver Health a while back, and it looks horrible, and it was and is, but she got out of this okay, pretty much normal. Very carefully removed the knife and took out some of the blood, and she ended up in the psychiatric ward. And I was talking to the psychiatrist one day and asking him about, well, is her depression any better? And he answered me, said, what do you mean depression? She doesn't have depression. She had a psychosis reaction to methamphetamine. And I went and talked to her about it. She says, yeah, I've been on meth for several years, and I've had a few of these along the way that I go crazy. And in this case, she went crazy, put the knife up against the wall, and did that. Now, she didn't know why she did it, but she did it. It wasn't a deliberate suicide attempt. It was, she couldn't figure it out, we couldn't figure it out, but I just find that interesting, because that's what's happened. And mild traumatic brain injury, or concussions, is being explained a bit on this slide, and I'll explain it a little bit more. It really is a complex pathophysiologic process affecting the brain induced by biomechanical forces. Now, that's a mouthful, and but that's determined by a group of scientists that get together every so often and try to figure out what it is and how to define it. Well, it's so much of what we know, blunt traumas, acceleration, rotational forces in the brain. It can happen with changes in barometric pressure, and it can cause some stretching of the nerve fibers. 70 to 80% of all traumatic brain injuries are concussions, if you will. 30% give permanent impairment. 20%, they never can go back to work. And again, very costly. And still, there's not any clear-cut diagnostic imagery or testing that we can do to define it or to separate it from the symptoms of post-traumatic stress disorder, which are almost identical most of the time. So you can only diagnose it by history. And we know now that repeated concussions cause cumulative damage. So it's not a ding, it's a traumatic brain injury. And what we see here, I was a member of the Colorado Boxing Commission because of some of my interests for several years, and I'm infatuated by the head injuries that you see there. I mean, or there. And I don't know if anybody's familiar with these two guys. Manny Pacquiao is a Filipino fighter who was really, as it says there, fighter of the decade during the 2000s. He's not only a world champion boxer and had many, many titles, he also has played professional basketball, and he gave up boxing to be a politician. He was in Congress in the Philippines for several years, then became in the Senate, and then he got beat on a Senate race, and then he ran for president the last time around, and Marcos, who's our president now, and Marcos beat him. So now he's back to fighting, and he's 40-some years old, and he's scheduled to have a fight against a guy by the name of Floyd Mayweather, who has never been defeated. They had the last bout that Pacquiao had, he lost in a decision, not a knockout. Well, I wanted to show you the video of a shocking knockout against these two guys, and I can't get it to work. So if you're all interested, just Google up Manny Pacquiao and go to some of the YouTube stuff. It'll show you a shocking knockout. But it's an impressive thing, at least, to people interested in knockouts and head injuries. Now, what happens when you get knocked out a lot or beat up? Well, we call it punch drunk. We've all heard of that. But it's called dementia pugilistica. And you knock the person unconscious, causing them to be that way. After a while, they get, some people say dumb or stupid, and that is called, as I said, dementia pugilistica. Well, the American Medical Association that in '83 wanted it to be banned. And, well, it hasn't been, and we weren't listened to, but, and it probably never will be, just because society wouldn't accept it. Muhammad Ali is an example. His later life of what some called Parkinsonism, but he had traumatic brain injury of a type that caused serious injury to the area that caused the signs of Parkinsonism, but he also developed dementia pugilistica, which is a form of dementia associated with boxing. And there's the question of why do some fighters never give it, and others do, and we don't know that answer. But it's being studied, and we'll go through a few studies a little bit. Then there's the mixed martial arts. Well, that goes back into Greek era, classic Greek era. They were having fights, and it wasn't until 1993 in our country that the term mixed martial arts came into definition. And it's been shown that, according to some measurements, you get beat up more than you do in judo or taekwondo or boxing or amateur other things that's been worked on, is that you're getting beat up more through this than in those sports. And a third of them suffer traumatic brain injury. And it's just what they do. And it's a source of entertainment. And if you realize, one of the guys close to our president is the head of the MMA. And he goes to their fights every so often. I don't expect you to read any of this, but these are trying to compare boxing and MMA. Is either of them worse? Do you get hurt more in one or the other? And it's you get hurt in both of them, I think, is what you need to take away. You get some fatalities, not a lot, but some. But you get a fair amount of people left with traumatic brain injury. And again, punch drug. And the studies are on and on if you are looking for them. Well, in 2013, the NFL formed a deal where they hired some doctors to come in and be on the sideline that are supposed to be, and I think mostly are, independent of either of the teams on the field. And I was one to go on with consultant for the National Football League, and I'd be on the field with the Broncos playing, and I'm not partial to the Broncos when it comes to this stuff. And so we would evaluate and determine whether they had a concussion, whether they could stay on the field or pull them out, or what have you. I spent several years doing that. During the early phase, the team physicians were challenged, and they gave us a battle, but by and large, we've all ended up very friendly. And we can admit football is very violent. And a lot of the violence is the head. But most of the disability really are joints, arthritis. You talk to a retired NFL player, and many of them are just, they're wasted as far as their bodies are concerned. But there's a condition called the second impact syndrome that often is in the teenager group, and where you get a concussion, either diagnosed on the field, dazed, knocked out, whatever, but then you come around, you get better, and you go back to play. And then it happens again, and all of a sudden, your brain swells up, and you die, or become disabled for life. And that happens, not too common, unfortunately. But this is what it is. Well, this kid, Zachary Lystat, back in the middle 200s is an example. In the state of Washington, had that happen, and was walking out of the stadium with his dad after the game and was fine, and then all of a sudden became, if you will, semi-conscious. And unconscious, very sick. Took him, he's still alive, took him, many, many years. He's not normal, he's severely dysfunctional. But that precipitated a law, and which was passed by Washington State in 2009. It basically says you need to be educated. Any symptoms of concussion, the child is out of practice or the game, and return to play can only happen if a trained healthcare provider allows it. Now, that's what it says. Oops. That's what it says in the state of Washington. There's another one in the state of Colorado in 2011. This young man, he died. And his parents took this to the legislature, and finally a bill was passed, and that's Governor Hickenlooper signing it, called the Snake-Burg Concussion Act. And that says that any athlete in the age range of 11 to 19 suspected of having a concussion must be removed from play immediately, isn't allowed to return the same day, and that includes practices. And in order to return to play, the athlete's required to have written clearance from a license. So you know there's a difference between the two laws. Well, there's some form of regulation in all states, but I can show you that every state differs. And some of these rules are in place for public schools and not private. And it's kind of a mixed bag that's still being worked on. Well, the brain is, I like to define it as think of a bowl of Jello, and you drop it on the floor. And if you finally look at it, you'll find little cracks that run through the Jello. And that basically happens with the brain, and we'll get to that. If you land on the back of your head, mostly the brain that's in the front is what gets hurt. And is shown there, and that's called a contractile injury. Well, here again, it's a type of traumatic brain injury caused by bumps, blows, jolts, all of these things. And it's the brain is sitting in a kind of a sea of water, and it jostles back and forth when you hit your head. And that is what causes the injury. Like if you've ever heard of shaken baby syndrome, that's where that happens in babies. So what's the classification of a concussion? Well, there isn't any. Concussion is a concussion. There's not a little one, there's not a big one. It's a concussion. And there's no such thing as a mild one. There's no grading system. And most of these symptoms resolve over 7 to 10 days. But you could have post-concussive syndromes, we'll talk about. Concussion is no test, I keep saying that. There's just no test that shows it. You have to diagnose it based upon their symptoms, physical signs, behavioral changes, changes in cognitive abilities, etc. 83% have headaches, 65% are dizzy, on and on. Things seem slow, you're just not working right. And then physically, you can develop amnesia, you get emotional, poor balance, But there's no, if you're examining a patient, other than those things, you don't find paralysis or anything like that. And so when you examine a football player on the field, the rule basically is, well, first you want to clear injury to the cervical spine because that's concomitant and can go right along with it. A lot of head injuries have cervical injuries. So you need to try and clear that and try to say, can you return the patient to play? And its rule is when in doubt, sit them out. No player shall return the same day. Well, this is all developed by every few years, a group of people get together, scientists that understand all of this and review all the research that's gone on in the previous series of years. And the last group of people met in Amsterdam, and we refer to Amsterdam studies. Before, it was in Berlin. But they determined the definition. That's where the verbiage came from to define the concussion. And they also then determined the type of examination that people like myself or team physicians or whomever give their people. And the CRT6 that's for a child under the age of 18. This is for older in the professional leagues or college leagues. And there's difference between college and professional big time. But these are several pages in length, very complicated, that we put the players through. And all the players have baseline cognitive exams that they've had, and you compare that at the time of their injury as well. You look at concentration tests, delayed recall tests, so it'll take time to go through all of that. But we're back to a definition that a concussion is a complex pathophysiologic process which affects the brain and is induced by traumatic forces. And there we are again. To return a patient to play, depending on the rules, and the rules differ, but we now have graduated return to play. Once they've been taken out of the game, and they're not deemed healthy to go back, it may take them several days, several weeks, depending on how that works out. So in the National Football League, we have neurophysiologic testing and evaluation. Post-injury evaluation goes on and on. They're really trying to cut down on the incidences of injury and repeated injury. To predict recovery, it's limited, but it differs between high school, college, and the professional on age as the brain is evolving in their life. And in high school, for a professional, it's 3 to 7 days. College is 5 to 7 days. And in high school, it takes up to 30 days sometimes, on and on. And to recover, 95% recover in 3 months. Longer, younger athletes and female, it takes longer. Post-concussion syndrome, the presence of symptoms for at least 3 months. Deficits, imbalance, 5 days. Cognitive tests, 5 to 10 days, on and on, just to give you an idea. And then academic, what do? You can excuse them from school, excuse them from homework, etc. And the post-concussion syndrome. people that have symptoms for up to 3 months. There's a group of those. Those are the group that we used to send to a psychiatrist. Now we have separate clinics that we'll send patients to and to help them get through this period. And if you've had a prior history of a concussion, you have significant increased risk for having another one. And 16% in that study. So you don't want to play when you've had a concussion. There's a small incidence of the second impact syndrome, as I defined before. And there can be permanent disability from traumatic brain surgery or traumatic brain injuries. So again, how do we know it's a concussion? If the player gets up, has no immediate complaints. That's not easy. If you watch and study the NFL plays over and over, and we'll be watching them on video, on the camera, and you watch the player, he may get up and seem okay, but the question is, he had to have something happen. And to make a decision as to whether they stay in the game or not, now we become, I say we, those of us as independent observers, we call that shot. And then we get blamed for it if we're wrong. And when you get blamed for it, there have been lawsuits, there have been all kinds of issues, especially if the person gets bad again. So it's a risky position to find yourself in. So there have been studies of where we put what are called accelerometers in the helmets. And if you get hit, for instance, you wide receiver and you bam, it can be up to 100 G forces, and you can measure that. A lineman receives 20 to 30 Gs on every play when he goes in and hits somebody. So we found all that. But what good do helmets do? We'll cover that. We know that multiple concussions, again, can cause problems. We have a second impact syndrome. A risk of concussion is 4 to 6 times greater after you've had one. After you've had 2, it's 8 times greater. So we're faced with all of this data and often don't know quite what to do with it because it becomes debatable. And that's what's changed in the game. If you study the amount of weight of the lineman from 70 to 2,000, and now it's gone up another 10 pounds, those are tough people to battle into or to tackle or to get hit by. We know that spearing is a law that we don't allow as much as we can, but it's still argued. They shouldn't use their helmet as a spear. Always make contact with the shoulder, and we know that's being argued over and over on every game as to whether it should be. I said, do helmets work? Well, helmets prevent skull fractures. They actually questionably prevent concussions. In fact, there's some evidence they cause concussions. And the mouth guards prevent dental injuries. And that's what they do. They don't prevent concussions. Some animal brains are different than ours in that their heads are, because the brain is in a tight compartment. These animals have thick skulls. There's no space between the skull and the, so they can butt their heads all day long and they don't get this color poo sloshing back and forth effect. And they don't seem to get symptomatic. A friend of mine actually created this and made a lot of money off of it. And that's this little collar. Kind of a bird brain idea that came from a bird. And from everything we can tell, doesn't do any good. But in a woodpecker, why don't they get screwed up? And, you know, they pound their heads all the time. Well, they have a back of their tongue wraps around the venous blood supply coming out of the brain, and it allows the blood to get back into the brain and cause a space, and increase the space. So supposedly that's what it does. It's, I think, theoretical. But so he invented that collar, made a lot of money off of it. It's not used anymore right now, but any of you ever see some of the movies popular a few years ago? This gal was a neuropathologist in Boston who really made this part of the problem popular and defined it and identified it. And that is what's called CTE, chronic traumatic encephalopathy. And it's associated with protein deposits and increased protein within the brain, akin to Alzheimer's. It's a different protein, but it kind of does the same thing. And that's been measured, and she kind of discovered this. And in 2023, of 376 that were studied, 345 tested positive. These are tested by examining the brains of people that most NFL players that donated their brains to us. So that suggests that a very high percentage of those players had CTE. And it's a pretty serious thing. That's where you'll hear of these younger players, football players, commit suicide, go off the wall. I mean, that's what this is all about. They're developing a significant amount of CTE. And it's a serious problem. And involves younger and younger players now. We're studying it into teenagers, even into, it happens in some. The prevalence of these people with chronic traumatic brain is estimated to be as high as 5 million in our country. We're studying whether we can identify it by a blood test or a spinal test, and pretty close, but not yet. Although in Alzheimer's, we can now identify that by a blood test that measures the proteins in the blood that come from the brain. So what's next? Will players buy into the current concussion protocols? Some of them do, some of them don't. How do we catch concussions immediately? We can't. What's the effect of the subclinical? We're not sure. Who's at risk for long-term neurological problems? We're not known. Can we demonstrate that we're making a difference? Probably, but not by great rounds. What's the future contain? Well, we cannot see it by a CTI or MRI. So we have this whole list of other studies that we're doing including measuring stem cells, genetics, genes, biomarkers. We're making step-by-step little progress, but no real breakthroughs. But the tip of the iceberg. And we're getting into comprehensive neuroimagery. I won't bore you with all of that, but we study the fibers in the brain now and look for any of these that are broken in various areas. And we're making progress doing that. We can, by looking at all this, we can maybe see right in here how this shouldn't be here. This is a study that shows out of Purdue the differences among high school football players In a 2-year study, it suggested concussions are likely caused by many hits over time and not from a single blow to the head, as commonly believed. And that's why some of these newer tests that we're doing. I'm just going to list these to show you. I was kind of involved in this in the early days when I was in law school to show that people that have concussions and normal MRIs and brain injuries develop problems in their brain. I mean, these are the fibers in our brain. It's very complicated stuff. And I got a lot of lists of bad news for football. And this goes one study after the other. One found that higher exposure to head trauma correlates with lower brain volume. The more you play, the brain atrophies. It also is compared, the more you play, the less able you are to think or cognitive impaired you become. There's studies all along the line. And it just makes you wonder, should it be allowed, should anybody ever do it? I'm not saying that at all, but I think the more educated we become, maybe we'll come to some more sensible answers, because unfortunately, nowadays, a lot of this is controlled by the amount of money you can make off of it, both in college and professional, and I don't think enough attention is being made to all of this. But, and you didn't know it. The media, nobody's told you this. A lot of parents are concerned, but not much is being done. Well, in 2016, that was a high of all the investigations showed, and it was on in Time magazine, very news media thing, but what's happened since then, hopefully it went down, it hasn't, it continues to go up. And in the university, it goes up even higher, 20% or so. Now, these are our grown-ups in a Bronco game. We go crazy down there. You haven't seen one come down and become in pain. You can sit there and look like that and bet on your phone. They now put a system in the stadium. You can bet on the phone on every play and make or lose money. It's interesting to sit and watch. And then we have distracted walking syndrome. And this is really a syndrome that we see. I've had 2 patients that walked into the light rail downtown, on the mall in downtown Denver, that I had to care for. One pretty bad. And that data shows that that's becoming more and more significant, of people walking with their phones on running into things. Well, we come to Saratoga, and hopefully we can prevent this. Thank you.
It ain't good to do that.
I had a question. When you were the physician on the field, when you were for the Broncos, did you ever have any pressure on you to put somebody back?
Yes.
A lot of pressure. Yeah, especially in the playoffs and stuff.
Yep. Yeah, and I mean, if it wasn't my partner, we would be divided up, one person on each side of the field to watch each team, those teams. And my partner, well, I'm going to forget the details of the name, but anyway, there was a playoff game, or a game that we had against another team that his quarterback was getting roughed up. And got roughed up pretty bad. And she was pressured to not call a concussion and not to bring him off the field. And she didn't. She went along with it. And afterwards, she ended up in a year of depositions. He and his team had obviously had a concussion. They didn't bring him off the field. She was blamed for not doing that, which in part was true. She could have. And he ended up being hurt and not able to play for several games with a lot of loss of money. And so they sued her. And she ended up in that kind of a battle. Rather than sue the coach or the team or whatever else, that's the position you found yourself in. And it became more and more concerning that no matter what you did. And so yes, the pressure was there.
Did you get paid by the NFL or the teams, or how did that work?
I've got to step up.
Did you get paid by the NFL? Or?
Yes.
Oh, okay.
Yeah, we were being paid. Not much.
Uh-huh.
Not much.
You got free tickets to the game. Right on the field, you got free tickets, right?
Yeah. It started out to be all inspiring to be down there with all of it and be part of the action. And I was getting older by the time, and there was no place for us to sit. We had to stand all the time. Now we're up in the booth watching it on video clips, what have you. But,
Oh, jeez.
so, hi.
How you doing,
How you
Gene?
doing today? So, any other questions? Shoot 'em.
I have one more about the helmets. Have they really, they say they improved them, but you believe that? Or I know they improved them, but not where it's going to make a difference? Or?
I think helmets do make a difference but not for concussions.
Mm-hmm.
There are injuries that can penetrate your skull or cause skull fractures and things of that nature that they prevent. But going one step further, I think the data shows if you want to get the biggest bang for your buck on a helmet, we ought to be driving with our helmets. And if you evaluate all the data and look at it, that's where it will do us the most good. But I don't think I've seen any study that shows that it prevents concussions. But they make a lot of money off of helmets.
Oh, sure. Yeah.
Every year. And now we have these little soft pads that fit on, and that's, again, a marketing type of thing. And the marketers will do a test, and they don't have good data, but they'll take what they can and say it helps, or it might help. And that's all you need to say to sell it. Okay?
Yep.
Yeah, one more quickly if anybody else doesn't have one. About the parents, if they're under 18 years old, I know that parents got to sign a waiver or whatever that is, but are they really educated on the brain injuries with kids?
I don't think so.
Absolutely.
And they don't want to hear it either, I don't think. I mean, we're so addicted and invested in this, and I am too. I don't want it to go away. But if I had a young kid, I'd be very watchful.
Yeah.
And James for the LA Lakers, basketball player. I have a slide someplace. When his kids were younger, he wouldn't let them play football. And there's a number of those around.
Yeah, makes sense.
But you can't keep a kid out. It's hard to discipline your child in that regard.
Yeah.
Now, a lot of soccer And that's coming on. We're going to have a World Cup this year. And a lot's going to be made out of the fact that it's a safer, and I think it is safer by and large. But they can have trouble also, and they do. Hockey
The
also.
hockey play also, yeah. Is the incident pretty high? Incidence is the incidence of concussions pretty high? In
Yes.
Hockey, professional hockey,
Yeah.
the way they get slammed around.
Yeah, it sure is.
Yeah.
And pretty much it equals out between hockey, rugby, and football.
Yeah.
Yeah.
And rugby players have less shield.
Oh, yeah.
shield.
But you know, and then you look at boxing. I mean, all my life, boxing has been a popular thing. I mean, going through the various fights. We don't see too much boxing anymore. But when I was a kid and younger, it was on every week.
Friday night fights.
Yep, absolutely. Pabst Blue Ribbon. Yeah. Have a beer and hit yourself.
Yeah.
And motorcycles too.
Yeah.
You've probably seen it all though, I'm sure, from battlefield to football to.
Yeah, and then these, bike injuries, horseback riding.
Oh,
You know,
yeah.
we're subject to this stuff a lot that we don't think about. Now, I think helmets can do more good on horseback and a bicycle than a lot of others. And probably even motorcycles, more than motorcycles. A motorcycle, you usually get creamed. A helmet doesn't matter. But if you're stopped and a car comes up and bumps you, and you fall off, that can be very helpful. Yeah. But yeah, I've seen all kinds of crazy things. Okay?
Thank you.
Okay, thank you very much.